Diabetes care. The little secret no one told you. My first experience with diabetes was when I was 12. One of my aunts was diagnosed with uncontrolled diabetes. I knew diabetes was serious, but it was also a disease people experimented with. It was those times when people liked alternative concoctions to cure diabetes and hypertension. I particularly remember an Arabian magic herb heard of curing madhumeha, which my aunt's friend was raving about. This conversation again happened when I was a second year medical student. My aunt was still looking for the magic cure and only taking insulin when things got bad. Do you get the timeline of experimentation? Long story short, my aunt didn't take the insulin regularly until she was diagnosed with multiple complications of diabetes, and the doctor laid it out for her. But old habits die hard. My aunt continued her seesawing with the diabetes treatment. My lovely aunt is no more, and her smiling, happy face is now a memory. You are listening to Dr. Amrita on the Health Wellbridge podcast. Scenario 2. One of my uncle-in-laws was diagnosed with diabetes mellitus when he fractured his leg. It was a wild blood sugar situation. Now, until then, he had never even checked his blood sugar. Luckily, he listened, diligently got his insulin shots, and his fracture healed without much drama. Diabetes is now a chronic, non-infectious pandemic disease, and everyone and their pets know what a pandemic is. But it doesn't get real until you understand the numbers. It's a long-term condition that affects you, your family, and society as a whole. So the stats for diabetes are like this now. Almost 500 million people, 463 million to be exact, as in 2019, are living with diabetes. 1 in 2 people don't even know they have diabetes, which makes it a very big problem. I shared these stories because many of my patients too show similar confusion about the insulin therapy. I have tried to explain to all my patients with diabetes to keep their blood sugar always in order. My aunt's problem and need for a natural solution helped me see the situation differently. Insulin is not a medicine. It's something your body already produces. But in people with diabetes, this is either not in the right amount or not working in the right way. Insulin is a normal hormone secreted by your pancreas. In diabetes mellitus, insulin for some reason is not enough or doesn't work, not doing what it should be doing in the body. While there are genetic causes behind diabetes type 1, which is an autoimmune disease, type 2 diabetes is a lifestyle disease. Obesity in adults and children is a massive factor behind the problem of diabetes. The good news is that with a customized diet, exercise, medicine, or insulin, you can stop the steamrolling of diabetes symptoms. If you want quality of life, always keep your blood sugar under reasonable control. It's not about that one time, but every time the sugar crosses a threshold, it gets trapped inside the tissues and causes trouble. That's why being aware of the type of insulin you need is essential. It's also crucial to choose the right way to get this insulin inside your body. It will be multiple times a day and needs to be easy, convenient, and pocket-friendly without risks. So what are the different types of insulin? According to when the insulin starts to act and the duration of action, insulin can be divided into several different types. The most shortest acting is the rapid acting insulin, which starts or rather peak activity at 15 minutes. Its duration of action is generally 3 to 5 hours. A short acting insulin has a peak activity 30 to 60 minutes after being injected and has a duration of action 5 to 8 hours. The intermediate acting is 1 to 3 hours when the peak activity happens, and the duration of action is 10 to 16 hours. The long acting insulin works for 24 hours or more, and generally the action peaks after 1 hour. Premix variety, 15 minutes of peak activity and duration of action 10 to 16 hours or more. Most insulin-dependent diabetes needs a balance of short-acting and long-acting insulin for control. How can you take insulin and how do you choose the best method? One of the oldest methods is an insulin syringe. A popular alternative choice is an insulin pen. Other options are an insulin jet injector and insulin pumps. What is an insulin syringe? It is a common method. It is a special syringe with a tiny needle, cheap to use. The person must adjust the dose of intake manually. What is an insulin pen? An insulin pen is less painful than an insulin syringe and much less complicated than a jet injector. It may be disposable, preloaded, or reusable where cartridge must be loaded. Former is excellent for those with poor eyesight as it stops the problem if manual adjustment is needed. The insulin pen is popular, cost-effective, and user-friendly. Insulin jet injectors. This helps insulin entry without needle. The cons are high cost, a complicated method with risk of wrong dosing. Insulin pumps. This is body worn and has a small catheter attached to a region on the belly. Timely graded doses of insulin are delivered. It helps to drip feed the insulin in a controlled manner and adjust according to meals and the overall lifestyle. Why is the choice of type and dosage of insulin necessary? The type of insulin and dosage is crucial for managing diabetes mellitus and preventing the organ damage. Diet, exercise, stress, infections, other diseases and medicines can alter the body's insulin level. You should consult only your doctor for a good plan regarding insulin intake and not have random experiments. The problem of excess insulin and hypoglycemic coma is life-threatening. Our brain depends on glucose to work, so a wrong high dose of insulin will starve the brain. A low insulin dose and a high blood sugar will cause organ damage. During excessive stress, post meals or exercise, insulin need may change. The poor infection control causes spikes in blood sugar and a high blood sugar makes infections prolonged. This is the reason behind the vicious cycle of swinging insulin need and uncontrolled blood sugar. So the takeaway from this diabetes care topic is when you have regular blood sugar and on a good diabetes mellitus care plan, there is a lower risk of aggressive infections taking hold and less chance of diabetes related complications. Diabetes has the power to affect each cell and system of your body. So never let it grow powerful. If you are someone with diabetes, watch your blood sugar like a hawk. Every step is essential. Talking to your doctor about what type of insulin and which delivery system will work best for you is crucial. Diet, exercise, regular monitoring, and adherence to medication are important factors in diabetes management. Empower yourself to live better with diabetes and take this pledge today. You are more than your diabetes. So take the pledge of more than my diabetes today. Health Wealth Bridge Flash does not provide medical advice and is for informational and educational purposes only and is not a substitute for professional medical advice, treatment or diagnosis. Call your doctor to receive medical advice. If you think you may have a medical emergency, please dial your local emergency response phone number. Thank you. This podcast is brought to you by Health Wealth Bridge, and I'm Dr. Amrita, ENT surgeon based in Kolkata. Thank you so much for listening.